Staphylococcus aureus. Commonly known as Staph aureus gram-positive cocci. Round-shaped, bacterial member of the microbiota of the body, frequently found in the upper respiratory tract and on the skin. Coccus in shape but glow in clusters like grapes, so look alike grape clusters. Gives purple color after gram stained because of peptidoglycan cell wall. THTSY these look like grapes cluster, gives yellow or golden color on agar plate and gives beta hemolysis. Gram-positive and facultative anaerobe. Can live with or without oxygen. Staph is non-middle and non-spore former. It contains an enzyme named catalase that converts hydrogen peroxide into water and oxygen. But there is a problem that other bacteria like Staph epidermidis and Staph saprophyticus are also catalase positive. To overcome this we perform coagulase test in which fibrinogen is converted into fibrin, forming agglutination. Agglutination shows presence of Staph aureus. Staphylococcus aureus is the most common bacteria of our body, normally present on our skin in the armpits, nostril, and Staphylococcus dominates our skin flora. Ecosystem amount of Staphylococcus bacterial load depends upon sweat, pH, humidity, hairs. From person to person sometimes it get penetrated into skin causing eczema. Staph can cause severe infection if gets inside skin. It causes dental abscess, pyelomyositis, osteomyelitis, osteoarthritis after getting in blood and causing bacteremia. It can make its way to other organs like heart, brain, and other parts of the body. In brain it causes bacterial meningitis, in lungs it causes pneumonia, and in heart it gets into valves causing infective endocarditis. In spite of skin infections, it can also get into body through open surgery or dental medical procedures. It can be highly risky for immunocompromised persons, and with infective endocarditis these people must be given proper antibiotic through for treatment. Staph aureus can also produce biofilm on the catheter site or on infectious sites. Biofilm is an essential layer of slime where Staph aureus live bacteria starts forming extracellular matrix which contains EPS bacteria that are enveloped by extracellular matrix, interact through biochemical signaling, and can exchange matrix and NA information through it, including antibiotic resistance genes. Staph thrives but don't easily divides. It is difficult to remove bacteria from infectious sites for antibiotics, so we have to remove that surface. Staph can release superantigens or toxins. Number 1 is toxic shock syndrome. Number 2 is leukocytin toxin. Number 3 is hemolysin. Number 4 is enterotoxin, and finally number 5 is oxalotin. Toxic shock syndrome produces at site of infection. It combines two major histocompatibility complex type 2 or MHC2, which is a receptor found in antigen-presenting cells. After binding it releases a lot of similar inflammatory cells called cytokines. It causes many physiological changes like rashes, fever, blood pressure, organ perfusion, and death. This is called toxic shock syndrome. Leukocytin toxin kills leukocytes through necrosis. This causes inflammation and mostly causes necrotizing pneumonia that destroy organ cells and tissue, death causing organ failure and death. Hemolysin is a pore-forming toxin that destroy erythrocytes which contains hemoglobin containing iron. Staph aureus uses this iron for its metabolism. Oxalotin toxin causes staphylococcal scalded skin syndrome. It gives patches of red skin and blisters of fluid. Enterotoxin is mostly found in food. It remains active even after cooking. It can withstand 100 degrees Celsius for a few minutes. It can cause vomiting, diarrhea. If it gets in blood it will cause toxic shock syndrome. Treatment include antibiotics, which can easily be overcome by Staph aureus. Penicillins are beta-lactam drugs that break beta-lactamase ring that leads to bacterial death. There are 2 resistant strains of Staph, MRSA, methicillin-resistant Staph aureus, and second one is VRSA, vancomycin-resistant Staph aureus. Antibiotics commonly prescribed to treat staph infections include certain cephalosporins, such as cefazolin, nafcillin or oxacillin, vancomycin, daptomycin, cubicin, telavecin, vibativ, or linezolid, Zyvox. Gram-positive. Cocci in shape. Grows in clusters. Normal microflora of skin and nostril. Adaptive to antibiotics. Resistant. MRSA and VRSA beta-lactam drugs.